Hi, everyone. It's Melissa, and we're back at For Strength in Numbers. So, our topic today is control chronic conditions. Don't let them control you. And I'm just so glad that you decided to hit play on this recording or to share it with your group. We've been together for several months now, and I hope that you are using this program as a way to meet some of your health and wellness goals. And it's motivating you, just like it's been motivating me. So, welcome back. Today, we're going to talk about the goals that we set last month. If you had the chance to do that, if you didn't set a goal, maybe you can just talk about some of the things that you've got going on, things that you're working towards, things that are maybe challenges to achieving goals, that sort of thing. And we're going to talk about ways to prevent or delay the onset of chronic conditions and the importance of a healthy lifestyle in the management of chronic conditions. I do want to let you know there's a lot of helpful information in the handout that goes with today's lesson that I've either emailed to you if you're a group leader, or your group leader will share with you. And so I hope that you can use those as a reference. And with that, I'm going to move into today's presentation. So it's changing the slide here. Please take time to reflect on those goals that you set last month, or just do a short reflection on how the month was in general if you weren't able to set a goal. But hit pause here, and then when you're done, we'll jump back in. Okay, so I hope that reflection was helpful, maybe remotivated you, recentered you for setting a goal later today, as we always do. So what I'd like you to think about now, and you don't need to raise your hand, you don't need to answer this out loud, but think about, do you yourself have a chronic condition or conditions, or do you know or care or work with someone who does? It could mean that you have high blood pressure, diabetes, heart disease, obesity, gastroesophageal reflux disease. That's a hard word to say. That's GERD for short. Often that's referred to as GERD. Arthritis, osteoporosis, macular degeneration, or some other chronic condition. So you can think about if you have one or more of these, or if you know someone who does. And think about, how does this impact your life? And actually, if you have time in a group setting to talk about this is a really good discussion topic because chronic conditions can have a really big impact on our life. You know, I hear from some of the people I work with in other classes that you almost get this fatigue, like this self-care fatigue when you have chronic conditions that you're dealing with. So let's say diabetes, for example, you know, watching your blood sugar, watching what you eat, counting your carbs day in, day out, that can, you know, lead us to a place at times where we might feel burned out and we just don't want to have to try so hard all the time. And I just want to validate those feelings, that you're not alone, that is normal feelings that many people who have chronic conditions experience. But, you know, there's just a lot of things that we can consider here. So if you have time to think about it yourself, maybe jot this down, do a little journaling, or discuss it in your group, I do think it is a great thing to do. When I think about the chronic conditions that I have, I think it, for me, just adds this underlying worry, this concern that's on my mind pretty often. And I think about, what will this look like in 2, 5, 10 years down the road? And for the chronic condition that I deal with, it makes it so that things are just harder. Like those blocks are set up against you in a way. It for me, it's sometimes harder to maintain my weight. It's harder to feel energized. And that can be frustrating sometimes, especially when I add that to like other parts of my life. I'm a mom of 3, you know, I'm working full time. And so sometimes I just get really tired, and honestly, I get cranky about it. And so that's sort of how it impacts my life. I've got the worry, I've got the mood issues, I've got the fatigue. And so maybe you can relate to that yourself as well. So I'm going to go ahead and move on. But again, if you'd like to take some time, please do here. So in 2025, The CDC, Center for Disease Control and Prevention, reported that 3 of every 4 American adults have at least one chronic condition, and over half have 2 or more chronic conditions. Okay, so a lot of people are dealing with more than one thing going on at a time. If we look at this and we break it down, we see that adults ages 65 and older have more than 90% of these individuals, 65 and older, have at least one chronic condition. Midlife adults ages about 35 to 64, 75% of that group have at least one chronic condition. Younger adults have chronic conditions too, and about 60% of individuals aged 18 to 34 have at least one chronic condition. Many preventable chronic diseases are caused by a short list of risk behaviors, such as smoking, poor nutrition, physical inactivity, and excessive alcohol use. The disabling and long-term symptoms of chronic conditions cause extended pain and suffering, decreasing the quality of life for many. People with chronic conditions face significant expenses as well. 90% of the nation's $4.9 trillion in annual healthcare expenditures are for people with chronic and mental health conditions. Interventions to prevent and manage these diseases can have significant health and economic benefits. So it's quite expensive, not just to the nation, but to our livelihood. So we are maybe spending more money on medications, going to the doctor, emergency room visits, instead of being able to use that money for things like a gym membership, a vacation, updating our home, like maybe we have some repairs that we need to make. And so it really kind of affects us and our choices financially. Missouri officials have identified diabetes prevention and treatment as a high priority. Somewhere between about 10.5% and 12.5% of adults in Missouri have diabetes, which is a chronic condition. And the average cost of care for a person with diabetes is more than twice that of someone without. Rates of heart attack, stroke, and death from cardiovascular disease are 1.5 to 2 times more common in people with diabetes than in those without diabetes. You don't have information in your handout about diabetes because we're talking about it now. So let's think about this. What is diabetes and why do you think it's so dangerous? And if you'd like to discuss this in your group, you can. I'm going to tell you though here shortly. So if you have diabetes, your body doesn't make insulin or isn't using the insulin as it should properly. Insulin is made by the pancreas, and it's the key that helps unlock cells so that glucose or blood sugar can get into the cells. Glucose, we need it to be in the cells because it helps provide fuel for our cells and for our body. If the glucose can't get into the cell, it can eventually cause a number of problems. So some signs and symptoms of diabetes are frequent urination, blurred vision, excessive thirst, feeling tired, and increased appetite. A person can have diabetes without experiencing any symptoms, and that's why it's important to be regularly screened. The American Diabetes Association recommends screening for type 2 diabetes at age 45, a procedure that's also suggested for people under the age of 45 if they're overweight or have other risk factors like sedentary lifestyle, a history of diabetes in their family, high blood pressure, or heart disease. If your test results are normal, you should be screened every 3 years. If your test results are borderline, ask the doctor when you should return for another test. For your reference, a normal blood sugar level is a reading of less than 100 milligrams of glucose per deciliter of blood, and a reading of 100 to 125 milligrams per deciliter is categorized as prediabetes. A reading of 126 or higher on 2 different occasions is considered diabetes. And so that's a lot of numbers. That's a lot of information that I've just said to you. This is just a great conversation to have with your doctor. But my guess is if you're going to the doctor on a fairly regular basis, getting your yearly checkups and that sort of thing, this conversation would be happening. But if you're like me and sometimes you prioritize like your kids getting their doctor's appointments in, and sometimes I forget about myself and how important it is that I too am checking in with my doctor on occasion, you may need that little nudge to like go in and just have these questions and say, what kind of tests do I need to be doing, and that sort of thing. Just to just to check in, give yourself peace of mind and make sure you catch things early in case anything is going on. Okay, and I want to just reiterate that it's really important that you know that a person can have diabetes without experiencing any symptoms. So though sometimes symptoms do appear, sometimes they don't. And so that is, again, why it's good to just be regularly checking in and making those doctor's appointments. For people with diabetes, diet's fairly important, right? One of the most important diet issues for people with diabetes involves eating the correct amounts and types of carbohydrate foods. Carbohydrate foods are the foods that are converted to glucose in the body. And you can think about what kind of foods have carbohydrates. And I'm going to actually show a slide with some of those here right now. I'm going to show you. So some common foods that contain carbohydrates or carbs are grain-based foods, milk, fruits, starchy vegetables, sweets. Those are some foods that we associate with carbohydrates. Now, we've already talked about the fact that a person can have diabetes without displaying any symptoms. That doesn't mean that the disease isn't creating problems for that person. If diabetes is left untreated or not kept under control, it can cause complications. Those potential complications include heart disease, stroke, kidney disease, eye damage, and nerve damage. All of these complications can make someone's life difficult in many ways. The good news is that if you are at risk for a chronic condition, or if you already have one, your lifestyle can prevent or manage it to some degree. Okay, you really can start to have more of a sense of like, I'm in control of this versus this is controlling me. And that is a much better feeling, right? So what do you think we need to do to prevent or delay chronic conditions? And this is a good discussion point if you have time in your space. And then I'm going to go over it in some of the next slides. Okay, so here are some tips to prevent or delay chronic conditions. Regular exercise helps keep our body fit and less likely to develop chronic conditions. If a person has a chronic condition, exercise can help manage it. For example, strength training can help manage heart disease and make it easier to perform our everyday activities by improving our muscle strength and our endurance. Exercise helps the body to use insulin more effectively, making it easier to control that blood sugar that I was talking about earlier. Exercise can help control the frequency and severity of asthma attacks. Back pain sufferers will be happy to know that low-impact aerobic exercise can actually increase strength and endurance in the back and improve muscle function. Core strengthening exercise help reduce symptoms by strengthening those muscles around the spine. Now, for those with arthritis, exercise can help reduce pain. Sometimes when you have arthritis, I've heard that people feel like if I exercise, it's going to be more painful. But actually, research shows that it can cut down on some of that pain and make those areas of the body feel better, less stiff. And so that's good news. We do want to avoid tobacco use. This is the most important thing you can do to prevent cardiovascular disease and cancer. Smoking impacts other diseases as well. We do want to maintain a healthy weight, which requires that we eat healthfully, right? Obesity can contribute to the development or how severe our chronic conditions are. And to prevent obesity and boost nutrient content in our diet, the World Health Organization recommends replacing saturated and trans fat with unsaturated fat. So saturated fat is fat that's usually solid at room temperature, right? So we find it in animal byproducts like meat and dairy. We find it in things like butter, coconut oil, lard, that sort of thing. So we want to cut down on how much of that type of fat we're getting. It's okay to get some. We're definitely going to get some, right? I eat meat. I get saturated fat. I eat dairy. But unsaturated fat tends to be healthier for our bodies. So like nuts and seeds, avocado, nut butters, olive oil, those sorts of things are what we call healthy fats. We want to eat lots of different types and colors of fruits and vegetables. Honestly, and I think I've said this before, if there's one thing that you do more of because of this class, I hope it's that you eat more fruits and vegetables because it's going to benefit you in so many ways. Consuming cereal products in the whole grain, high fiber form is going to be excellent. In fact, any grains that you take in, trying to get the whole grain options like the brown rice, the whole grain pasta, the whole grain tortillas, is going to be better because it has more fiber, more whole grains, it's less processed. Limiting the consumption of sugar and sugar-based beverages, really beneficial. Most Americans get far too much sugar in their diet, added sugar. Limiting excessive calories from any source and limiting our sodium intake or how much salt we're eating are also great recommendations. The dietary approaches to stop hypertension, or the DASH diet, is listed in your handout as a way to improve blood pressure. It's been proven to reduce blood pressure, but also can be good for weight loss or just a way to ensure that you're eating healthfully. It stresses the importance of whole grains, lots of fruits and vegetables, low-fat dairy, lean meat, nuts, seeds, and legumes, and limits fats and sweets. There's an overview in your handout, and you can get more information at dashdiet.org. Now, I'm just going to show you a few slides. These are actually clips from the handout itself. So it kind of dials into some specific chronic conditions or risk factors that you might experience. So high blood pressure is this first one. There's a 90% chance that middle-aged Americans will develop high blood pressure during their lifetime. It talks about when you go to get your blood pressure tested, they often give you two numbers. And that first number, the top number, is the systolic blood pressure, and it's when your heart is contracting, whereas that bottom number is called diastolic, and it's when your heart is filling to allow oxygen to enter the blood. And so a normal blood pressure for most people is 120/80. If you have different recommendations from your doctor, please listen to your doctor. I am not one, but that is just the average or like the normal for the general public. And so this is helpful information for those who might be concerned about high blood pressure. High blood pressure is affected by things like smoking, alcohol, our weight, particularly if we are overweight, and then our sodium or salt intake. Most Americans need 2,300 milligrams or less of sodium per day. So this is where we want to be reading the labels for those processed foods, maybe not over salting when we're cooking, like tasting it first and then seeing if we even need to add salt. We can find a lot of sodium in canned food, so beware of that. Look for the no or low sodium options. Anything that comes in like a box or a bag, or lunch meats, cheeses. You see this list if you maybe on the screen. Salad dressings, condiments often have a lot of salt. So those are some things to beware of if you are watching your salt intake. And as far as how we can decrease blood pressure, again, that DASH diet, but also physical activity. We can't control all the risk factors, right, that might increase our chances for chronic disease or high blood pressure or diabetes, all these things. So things that we can't control how old we are, unfortunately, right? We just keep aging, right? Our family history, our race, that is out of our control. So we just have to really dial into what can we control. Okay, we have some control over our blood pressure, over blood glucose, over our cholesterol and weight. And in your handout, it talks about the numbers. It says know your numbers to prevent heart disease. So ideal blood pressure, ideal BMI, fasting blood glucose. And this can just be a reference. But again, that conversation with your doctor is number one, right? And these are the general guidelines, but I don't know your medical history. So again, we just like to talk about this because there's in a way there's a lot of things that we got to think about and keep up with, and if we're not regularly getting those checkups, it can be hard to know where we are. And so I do want to encourage you to maybe this will motivate you to make that call, make that doctor's appointment if you can, so you can make sure you're in a good place and have tips for or steps for improving if need be. Also in your handout is some information on macular degeneration, risk factors and tips for you. There's some information in there about arthritis, if you are dealing with arthritis, as well as GERD. There's some information there too. So I just wanted to point that out without going fully into it, because it may not be of interest to every person in the room, but it very well may be to some of the participants in your group. So with that, as we always end, I'd like you to take some time to set a goal for this next month. It needs to be something that is measurable, something that you want to do. It can be health related in the terms of, like, it could be activity, physical activity. It could be eating healthy. It could be sleeping more, but it could also be something else, like that's kind of on your mind and sort of causing you stress. Like, I really need to go through this closet. I got all this stuff in this closet. It's driving me crazy, you know? That could be working on that one shelf at a time, one shelf every week or something, you know, to get that done and get that off your mind. So there's a lot of flexibility here, but take some time, set your goal, say how much you're going to do, how often, when, how confident are you, and who's going to support you in this goal. And with that, remember, change is hard, but there's strength in numbers. I'm here if you need anything. Feel free to reach out. Thank you for listening, and I hope I'll see you next month. Bye.